Our names are Aislinn and Sinéad, and we are two nurses working in the northwest of Ireland. This is our narrative on our journey in digital transformation and why we developed a digital transformation toolkit. Despite our experience in healthcare, we often felt we had to navigate a complicated maze of information when it came to delivering on digital projects. Luckily, we had our fellow students, colleagues and tutors to point us in the direction. We thought surely this information would be better in one place, and it came to us that by developing a one-stop toolkit, we could help others in their digital transformation journey. So this is our story, and we hope it will help others successfully cross the digital chasm. We both met in January 2020, and our journey started slowly, but little did we know this was about to change. COVID hit, and digital transformation began evolving at a pace that none of us had experienced. We found ourselves on a fast train and became part of a once-in-a-lifetime technology shift that is transforming healthcare. Eager to ensure we stay connected and provide ordinary care in extraordinary times, we looked at ways to keep engaged with our service users. We tried voice-activated smart devices for a research project, and they were well received by 70% of the older people who got them. Although generally people like them, we cannot stress data protection is key, and we found out about the importance of data protection impact assessment. We agreed to become champions of telehealth, and we both implemented a hybrid approach of face-to-face and telehealth into our services. Across 11 Sligo-Leitrim mental health services, we now have 109 licences and over 140 hours of video consultation taking place each month just across one platform. In paediatric diabetes, they have encountered many benefits for both children and parents in using telehealth solutions. Implementing telehealth has come with its challenges. Networks were poor, people often didn't have the right equipment, and digital literacy drastically varied across services. We have also been involved in several other digital projects. Aislinn is leading on the digital transformation in mental health and older persons in Sligo-Leitrim. Some of the projects she has been involved in since March 2020 include telehealth, supporting digital solutions in the new state-of-the-art mental health unit, rolling out conferencing and virtual interactive kiosks across service sites, supporting staff to become electronic health record ready, supporting the implementation of a training management platform for staff and service users, and supporting equipment and network rollouts. By ensuring that the infrastructure is in place, we are now looking at automated and artificial intelligence systems that help support local and national policies that outline preventative care models. Sinéad is leading on the digital transformation of paediatric diabetes service in collaboration with her colleagues, families and service users. All insulin pumps are uploaded to the cloud for review in the virtual clinics or ad hoc consultations with the children and families. Over 55% of children who are on insulin pumps are meeting national and international standards. Libra sensors are now applied at diagnosis, allowing for quicker discharge and monitoring in the home environment, using telehealth platforms to continue education post-discharge. Embedding technology in their service from the outset has allowed them to achieve better results and stay connected remotely. Provisions are always made for those that are unable to use technology. We are both leading on living labs, identified by the Digital Transformation Office. Using the quadruple helix, we have developed partnerships across users, academia, public service and commercial organisations. For older persons, Aislinn is looking at how to keep older people connected through community digital hubs and introducing a model to test technologies such as sensors and expert systems to monitor critical user data and predict possible health events using virtual ward risk stratification software. In paediatric diabetes, Sinéad is testing and piloting a new diabetes platform, and they are exploring robotic process automation for repetitive tasks within the service. and they are testing the new Medtronic 780G insulin pump. As we mentioned, all of this came with its failures, successes and challenges, but most of all it was the navigation of the maze of information that led us to thinking about developing a toolkit. But as our tutor Annette asked, does anybody else think we need a digital transformation toolkit? We did our research and it was a resounding yes from 209 people from various levels and departments within the HSE. Our toolkit was born. They also told us some more information. Nearly half of people felt they would need upskilling on several areas, including data protection and business case development. However, on a positive note, 56% felt they would get good support from their senior managers. So we set about exploring a toolkit using design thinking methodology. And then we looked at the delivery solution Artefact. Martin and Annette were quick to state, don't do another PDF. How about a mobile app or a website? What a challenge. After all, we're nurses. But nurses are resilient and love to be challenged. We get asked to do things all the time that aren't in our job description. So why not add website development to our skills? After several iterations on the Wix platform, we built our first prototype. We thought we were doing a great job until we sent it out for feedback. Wow, ouch, that hurts. But do you know what? They are right. So, back to another iteration building. Finally, we built an artefact. Check out our website. We have provided information, documents, training, signposting on each of the 5 strands of digital transformation: strategy and culture, engaging stakeholders, process and innovation, technology, and data and analytics. We have also included signposts to where you might get funding and some blogs on people's experience and thoughts on digital transformation. We haven't officially launched our website, but in the last 30 days, we already have had over 277 sessions with 103 unique visitors, including some people from the USA and France. By bridging the gap between healthcare and digital, our toolkit will help others to quickly navigate, accelerate, and set the scene for successful implementation of digital solutions in healthcare.